Okay, to finish up this unit on evidence-based dentistry, I've talked so far about why we do evidence-based dentistry and then how we do evidence-based dentistry. And I just want to talk you through the key differences between quantitative and qualitative research methods. The reason for doing this is that there's a key difference, different types of research methods, quite different research methods. And you're going to have 3 units following this on different quantitative methods before you then talk about qualitative methods. So I just want to outline them to give you a feeling for these different types of methodologies before you start on specific research designs. So this isn't talking about these different methods in any detail, it's very much a brief overview. Sorry for the busyness of this slide. It's taken from a web site that the link is there at the top of the slide, so you can go and have a look in more detail because there were a few extra points that I've not managed to fit onto the slide. Really I wanted to just show you this because it's a nice summary of the differences between the 2 different types of methodology. So on one side you have the quantitative and on the other side the qualitative. And it kind of takes you through key differences, starting with the types of questions that they ask. So with quantitative research, you're very much thinking about how many or the strength of an association, kind of thinking about totting things up and adding up numbers and coming to an effect size or a relationship, getting numbers out. Whereas with qualitative research, you're more interested in exploring. So exploring research questions, exploring them in more depth, getting an understanding, if you like, the what and the why type questions. With quantitative research, you're often testing theory, whereas with qualitative, you're developing theory. And so quantitative research is often about reduction. You're trying to control things. So randomized control trials, for example, you've got a specific question, you're trying to control what's happening to an intervention group and comparing that with a control group. So it's about precision. Whereas with qualitative research, you're thinking about questions that you want to discover interesting things about, you're describing, you're understanding, you're coming to an interpretation, if you like. So often when we have quantitative, the key thing that you look for is the stats. So quantitative research will nearly always have some statistical analysis. It will be based on numbers. So that's the key thing, the key aspect of analysis, the element, if you like, are numbers. Whereas with qualitative, you won't have numbers. They will usually report quotes from people, whether they're individual people or focus groups. There will be an element of words that is to do with, an element that is words or ideas. So there won't be numbers, it'll be about words or texts. So in quantitative research, you're usually testing hypothesis, whereas in qualitative, you will not have an hypothesis, it will be a research question. Usually in quantitative research, we use instruments or measures in some way. Whereas in qualitative, we probably won't have instruments. You might have a interview guide, but there won't be kind of variables and measures. In quantitative research, we strive for generalization. So we have a sample and we want to generalize from that sample to the population at large. And we want to do that because we want to predict or explain something. Whereas qualitative research is usually about uniqueness. So we're interested in understanding differences between people, but these are often small numbers of people because we want depth and understanding and interpretation. We're not attempting to generalize from those people to a wider population. In quantitative research, it's usually highly controlled. It's often an experimental setting. So randomized control trials are experimental, but it might be non-experimental like case control or cohort studies. In qualitative research, we are not controlling, we're not experimenting, and so often these will be done in a natural setting. So it might be done in the person's home, or it might be done in another setting out there in the real world, not within a laboratory. So in quantitative research, finally, you have a sample size, and the sample size will be reported within the text of the study, and there may be a power calculation to suggest why that sample size was chosen. Whereas in qualitative research, sample size is not a concern. and it often says that there will be a sample size of perhaps between 10 or 12 people, and they will get very small numbers. But that's not of concern because we're not attempting to generalise from the sample, so it doesn't matter that there may only be a handful of people. So those are the key differences between quantitative and qualitative research. As I say, if you want to look at those in more detail, then go to the web link at the top of the slide. What I want to do is just give you an example of qualitative and quantitative research. These are not necessarily dental examples. Within dentistry, qualitative research is certainly up and coming. You won't come across that much qualitative work. There are some in key journals, maybe interviewing kids about their experiences of dentistry, for example, or there may be focus groups with different patient groups. But it's few and far between, whereas most of the research in dentistry is still quantitative in nature. And so this first example of qualitative research that I'll show you is not a dental study. It's a study that I conducted before I came into dentistry, when I was still working within psychology. And it's a study that we carried out with women who had just gone through childbirth. And we were interested in their experiences of maternity care during childbirth itself and then immediately afterwards, postnatally. And so this was published relatively recently. I'm just going to move it down so you can look at the abstract here. So here you go in italics. There is the abstract for the research study that we conducted. And if you read through that abstract, there's a number of things that can tell you that this is qualitative research, because there are key words that you can pick out that will suggest to you that this was interviews with women. We weren't interested in measuring anything. We weren't interested in giving questionnaires on their experience. We weren't interested in getting numbers and then generalizing to a wider sample. What we were interested in doing was exploring in greater detail their experience of childbirth in the UK. And so what we did was we carried out interviews with women and with staff on maternity wards. In this study we had 24 women who were either first-time mothers or had given birth previously. And we interviewed them for what probably was an hour up to 2.5 hours in their own homes after they'd come out of hospital, about various aspects of the childbirth process, and specifically about what it was like on the ward after they'd given birth. And you can see as you read through this, there are the words experiences, for example, women's experiences, semi-structured interviews, small number of people, 24, transcripts, which are the interview just written out in full, emerged. These are all kind of key words to suggest that this was qualitative research, which was about the experiences and understanding. So when you read through an abstract, you don't actually need to go to the whole article, or very rarely do you have to go to the whole article to give you an idea that this is either qualitative or quantitative. Okay, so that was an example of qualitative research. What I'm going to do is just give you a similar example of quantitative research, just to give you a brief idea when you're looking through abstracts of studies, how to pick out quantitative research. So again, I've just chosen an example, one of my own with Peter Robinson, who will be taking you for one of the later units. So this is work that we conducted a few years ago on xerostomia, or dry mouth. And what we're interested in was people's experiences of dry mouth, but we're particularly interested in this thing called oral health quality of life. So this is the impact of their condition on their physical functioning, their psychological well-being and social well-being. And if I just move down the abstract here, you'll be able to read it. And so you can see right off really from the first sentence that this is going to be quantitative. It says the aim of the study was to systematically test Wilson and Cleary's conceptual model. So I said to you a bit earlier that quantitative is often about testing theory. And so here we have a theory, it's called the Wilson and Cleary theory. And we were interested in testing whether this theory applied to our xerostomia patients. And so we examined different pathways between their clinical measures. So we had saliva and the severity of the loss of saliva, because this is about dry mouth, and how that impacted on them day to day, so oral health, quality of life. And you can see again that this is quantitative, because we move on. We collected measures of clinical variables, self-reported symptoms, oral health, quality of life, global oral health, and subjective well-being. So we measured each of those with either clinical instruments or questionnaires. There were 85 patients who were attending outpatient clinics. And then in terms of the results, it's structural equation modelling. It's probably not something that you're going to be familiar with, but it's an advanced statistical technique which allows you to look at the relationship, the statistical relationship between all those different things that we've measured. And so this is about statistics, it's about testing, it's about predicting. So all those things I've said to you are very quantitative. And then it goes on in the abstract to talk about the different results. And then in the conclusions at the bottom, you can see it says the results support Wilson and Cleary's conceptual model of patient outcomes as applied to this oral health condition, that is xerostomia. And so what we did is we tested the theory, we used measures, we got numbers, and we statistically analysed. So it's very quantitative research. So there are just two very different examples of qualitative and quantitative research, just to show you the kinds of things you can look for when you're reading research articles. And I just want to say a little bit about the advantages. The important thing to think about with quantitative and qualitative is that neither is better than the other. They're used for different types of research questions. And so when you have your question, then you can decide whether you can use quantitative research methods or qualitative research methods. Don't think of quantitative as being better than, they're just different. And so quantitative, the advantages are that it's specific, it's replicable. So if you want to be able to replicate somebody else's work, then you would probably use quantitative. It's generalizable away from your sample to a wider population. It can, depending on the design, establish cause and effect. So if you want to know, for example, that xerostomia, having dry mouth, causes fewer impacts on day-to-day life, then you would have to use quantitative methods. You can't establish causality with qualitative research methods. In quantitative, another advantage is that the results are often presented in very accessible form, either in tables or figures in some way with numbers. In qualitative, the advantages are the richness. So, for example, you had something that there's been very little research conducted previously. For example, people's experiences of orthognathic surgery and that impact of orthognathics on their body image, their identity, their well-being. There's probably not much literature in that area, and you might want to conduct interviews because you might want to understand very much detailed impacts on their life, what it means to them, what it means to their family. So you would use qualitative research methods, you would interview them and their family. So it gives detail, it gives in-depth understanding. Rare phenomena get attention. So if you have very small numbers of people who have a condition, then you can't really use quantitative because you won't have the sample size. So you'd use qualitative research methods. You can also deal with ambiguity, that is uncertainty or greyness. There's no right or wrong with qualitative research. You are just presenting people's stories, what they want to say, their experiences, rather than coming up with a definitive answer to a question. So there are advantages to both quantitative and qualitative research. So the method that you use depends very much on the nature of the project and the project question. That will dictate whether you use quantitative or qualitative research methods, the type of information that you need, and also the availability of resources. And so often with quantitative research methods, they can be very expensive. Randomized controlled trials are hugely expensive to run these days, and often, other than the fact that often research questions can't be answered with randomized controlled trials, there's often not the time and the money and the people and the resources to fund those kinds of trials. And so often you have to do lower quality design work, or you do qualitative work. One of the approaches that we've used quite a lot within the School of Dentistry, within the Person-Centred and Population Oral Health Research Group, is mixed methods. And these methods combine both quantitative and qualitative data collection and analysis to answer a question. They can be really useful if you want to do qualitative work to find out the detail on a person's experiences, and then you design a study to test those experiences. And so they're often a two-stage process, very useful for certain types of questions. So just to give you an example of such an approach that we've used, we do a lot of research on dentine hypersensitivity, and we have got a lot of research funding from GlaxoSmithKline, who are interested in understanding hypersensitivity and its impact on people's everyday lives. And what they wanted to know is firstly how it impacted on their lives, the kinds of impacts that they experienced, and then they wanted to go and use this information to develop a measure that they could use in their clinical trials. So we adopted a mixed method approach. So the first part of the research was that we went and interviewed people who experienced dentine hypersensitivity. So we had long interviews, semi-structured interviews for probably an hour and a half with these people about what triggered their hypersensitivity, when they experienced it, the intensity, the bothersomeness of it, the types of foods, what they did about it, how they adapted, etc. And from this, after much analysis, we then came up with a list of different items that we could put into a questionnaire. We then went and tested these questions in focus groups to identify the key aspects that are of importance to people with hypersensitivity. So we did a series of focus groups with a number of people, came up with the most pertinent items to use within the questionnaire. In the second part of the research, what we did was we tested this questionnaire that we had developed with both a general population sample and a clinical sample, and we tested whether it actually assessed the impact of sensitivity on people's everyday life. And so we gave it to a large group of people, about 200 people. We got back the answers to that, so then we got lots of stats and we analysed it, and we could say who got what impacts, where the impacts were greatest, and we could also say whether this measure was reliable and valid for assessing the impact of hypersensitivity in everyday life. And so we then published this research. And so this is the abstract from that research. So we published a whole mixed method study, right from the initial interviews of the people with sensitivity through to the focus groups, through to the design of the questionnaire, and then the testing of the questionnaire in terms of its reliability and validity. And you can go and read that article in the Journal of Clinical Periodontology from 2010 to give you an example of kind of mixed methods approaches to research. This is probably not something you will do in your master's dissertation because it will obviously take some time and you don't have enough time to do a mixed method. So you will probably just do either a quantitative or a qualitative study, a one-part study rather than a mixed methods one. But it is something to think about if you carry on with research in the future as to the way to go with really exploring a certain research area in depth using qualitative and quantitative together.